let's talk about what are some of the sort of consequences of not addressing a condition in a timely manner. So even if you don't have symptoms, so let's say you don't have abnormal bleeding and you say, really, I have big fibroids, but I have no symptoms other than the fact that they're large. If you're trying to preserve fertility, it's extremely important to address the fibroids before they get so massive that there's been so much damage done to the uterus that preserving fertility is really has very poor prognosis. All right, because we can't, there's no magic. If the fibroids have grown to the size of a watermelon, and there's very little uterus remaining. So while we can potentially still salvage the uterus, it the functionality of it is questionable because it's already been so damaged by these fibroids. So if you've been diagnosed with fibroids and you want to preserve fertility, it's very important to see a specialist right away, even if you think that they're not very large. Same thing with endometriosis. Endometriosis progresses. It causes damage to the ovaries, to surrounding tissue, to the uterus. It's important to address it sooner than later. And again, a specialist opinion here is going to be extremely, extremely important. So please don't delay because it makes your life harder as this condition progresses, but it also makes the surgery more difficult, more risky. And again, the prognosis becomes not as optimistic when we're dealing with really a lot of delay in care.